Hi, my name is Sarah Critch. I'm the physiotherapist with the Janeway Lifestyle Program. I'm joined by Jennifer Green, the Recreation Development Specialist with the program. Today, we're going to take a little bit of time to discuss promoting physical activity to all body types. And we're going to share some background on an approach we use called a body positive approach.
So, our outline here, we are going to break down a little bit about the Janeway Lifestyle Program, talk about what is health, and get into body positive approach. What is a body positive approach? Why use a body positive approach? And how to use a body positive approach to create a safe space for physical activity. So, the Janeway Lifestyle Program, our vision is good health for everybody. This is a family-based program for school-age children who have been identified with indicators for chronic disease, parents of preschool children who are interested in learning how to raise healthy, happy, and active kids. Our mission is to empower all families in Newfoundland to be able to eat well, be active, and feel good. So the lifestyle program was developed because Newfoundland has the highest rates of many chronic diseases across Canada. And if changes are made during childhood years, many diseases can be delayed or completely prevented for these kids. Okay, so I'm going to get you to do a little activity. Just jot down a person that you admire. So I want you to list 3 reasons why. This could be anybody at all, but preferably not like a celebrity, someone that you actually know. So you can write that down. And now I'd like you to think about yourself. I'd like for you to list 3 things that you would want to change about yourself. This isn't going to be shared with anyone. This is just for yourself, and we will revisit this a little bit later in our presentation. Okay, so the body positive approach. Why do we think we needed to change our approach for providing physical activity or different programs for the kids in the Janeway Lifestyle Program? We were noticing that all the kids that we were providing support to had very low physical activity levels, and their sedentary activity levels were very high. So what that means, kids are not participating in any sort of movement-based activities and are doing a whole lot of sitting. We also found out that many of the children in our program had negative experiences with physical activity. So we're seeing a lot of exclusion, oftentimes in gym class, and this became a huge barrier to physical activity for them. So despite whatever physical activity was offered to them, they didn't participate in it. So that was in our own programs or even out in the community. So we needed a new approach. And how could we re-engage our patients?
So when we took the time to sit and say, okay, what do we need to do? How do we need to re-engage our patients? First, we went back to the research and said, what do we know about physical activity? What do we know about health? How are the two married? So we came up with 3 key messages that really became the springboard of knowledge for us to change our practical clinical approach. So I'm going to take a little bit of time to walk through these 3 main points, but the first is that we learned that health doesn't equal weight, that health is influenced by many factors, and that cardiorespiratory fitness has a very important role in health and is more predictive of health than weight. So the first one we're going to look at is that this idea that health does not equal weight. So first we wanted to say, well, what does it mean to be healthy and have a reduced risk for chronic disease? So in our population, it means that you're metabolically healthy. And what we mean by that is that you have normal blood pressure, cholesterol, blood sugars, that you have a normal sensitivity to insulin, you have a good cardiorespiratory fitness level. So you get all those things from regular physical activity and eating well, and helping manage your mental health. So we know that that's what metabolically healthy means. So then we said, okay, are our patients metabolically healthy? Are they not? We know that the people that are not metabolically healthy or metabolically well, they're the patients that need the people that need our services. So that helped us to focus on health as opposed to what a lot of healthcare professionals tend to focus on, primarily weight. And we know that we learned that when we were focusing on weight, and when we've talked to other people when they focus on weight, it kind of leads us to two main errors. One is that you reach out to people that may not need your help. So someone who's overweight but metabolically healthy. So there's about 31% of the population in this large study that they found that didn't actually need any intervention. They didn't need our services. They may have been in a larger body size, but they were well. And then even more concerning is that it led us to realize that there was probably about 10% of the population that weren't availing of our services because we assumed they were well because they were in a smaller body size or they were lean, when really they were very metabolically unwell. They were unhealthy and certainly needed help to reduce the risk of chronic disease. So that 10% would have been missed. So this really made us think, wow, we need to really take the focus off just the body size and look at health. And that we know that weight is acknowledged as part of the equation, but it's not the sole factor in determining someone's health, and that there's other factors to look for. So this led us into looking at health behaviors, family history, genetics, these type of things. So one large study that we found that we can certainly share is this study that was published in 2012 in the Journal of American Board of Family Medicine. It's a very large study. There was over 11,000 adults that participated. And what they did is they broke people down based on their weight. So they were either put in a normal weight, overweight, or obese group. But then they asked them 4 questions, all on health behaviors. So what those numbers on the bottom mean is 0 means that they asked the person if they were getting enough fruits and vegetables, so at least their 5 servings. They were active 3 times a week. They weren't smoking, and they were consuming a moderate amount of alcohol. So if someone answered no to all of those, or the negative response to all of those, so they were smoking, they were drinking, they weren't active, they weren't eating fruits and vegetables, they got a 0. And then right to the opposite, so if they answered the appropriate answer, or the answer we would want for all of those, so they were eating their fruits and vegetables, they were active, they weren't smoking, they weren't drinking large amounts, they got a 4. And so what was amazing when they looked at the risk of death, so the relative risk that they would die sooner, when they looked at people that were participating in all 4 healthy behaviors, so they got a 4, you can see that the risk of death became insignificantly different based on their body weight. So they were almost exactly the same. They were all hovering at that 1 level for risk of death. So it was really eye-opening to us that, wow, if you can really focus on health behaviors, this might be a way to go, and certainly highlights that, if you're in a larger body size or if you're in an average body size, that, health behaviors has a huge factor to play here, irrelevant of what weight classification you may fall in. So this was a real eye-opening study that we learned, and a real significant piece of knowledge that helped us say, maybe we really need to think about where weight fits in this picture versus health. Then we were looking at, so how does fitness play into this? So Jennifer and I are both kind of the activity people on the team. So of course, fitness level and physical activity is near and dear to our heart. So what does that play into this piece? And so with all the information that we read, we learned that cardiorespiratory fitness is a stronger predictor of health than weight. So similar to the previous study, then we know if you're participating in those health behaviors, you can be healthy or regardless of your weight. We know that your fitness level can change regardless of if you see a change in your weight. So this was there's one study we'll share that was eye-opening again for us. So this study looked at people who participated in a physical activity program for a set period of time, and then they measured 3 outcomes at the end. So they looked at their BMI, their waist circumference, that's the WC, and their cardiorespiratory fitness level. So what they learned is if they after the end of the physical activity, the group that had a decrease in BMI and a decrease in waist circumference and an increase in fitness level, so decreased weight, decreased inches, increased fitness level, their risk for chronic disease decreased. So that's exactly what we know and what the fitness industry thrives on, and certainly what's shared and tends to be the goal for most people. But what was certainly missed, in our education was often missed in common media is that there was two other groups of people in this study. One that had no change of their BMI, and another group that had no change of their BMI or their waist circumference. So didn't lose weight, didn't lose inches. But all three groups, regardless of change in their body or their anthropometric measures, they all had an increase in fitness level. Fitness level is a very sensitive change. So just in the 10 weeks that they did the program, they all had increased fitness level, and they all showed that they were at decreased risk of chronic disease. This is a very important message for us to get to our patients, because sometimes we can really get weighed down that if you're not seeing, meaning seeing your change in your body changes, you think that this might be a waste of time. So that was a big eye-opening thing, a point to learn rather for Jen and I, to say, wow, so you can have change in your fitness level and really help you decrease your risk of chronic disease regardless of a physical change that you can see in the mirror. So certainly one of the messages we now share with our patients is that you can be fit in many body sizes. It's not that it's just one size fits all. It's about how healthy you are on the inside. And then the last point we learned was that health is determined by many things. So we had to take a step back and look at that big picture of what is the goal. If we know that all these things, and we've talked about some, just touched on them today about fitness level, smoking and drinking, and obviously the physical activity or fitness level. We know that so all these things affect health. All social determinants of health are really important. So how do we keep this big picture in mind, and how do we help our patients look at reevaluate their goals and how these things may affect their goals? So what we've learned is that we have to really focus on some of these other pieces as people identify that these might be problems, and not necessarily on weight, because if we only focus on body weight, we may be missing the mark for some patients. And if that's not going to change, but we can change some of these other determinants of health, we can really help that person become much healthier. But right now, health is for most people is interpreted through a lens of changing body weight. So for us, that really we had to kind of blow up that picture a little bit bigger and say, oh wow, we have potential to change some of these other things, and that may help. And so helping our patients understand that as well has been a big learning curve for us as we took in this information. One of the other pieces, after we kind of did the background work on what research was out there, we said, okay, so what happens if we did focus on weight? What would happen if that was the only thing we did focus on, if we kept going forward using kind of that old model? And we did come across some really interesting research. So one of the things that we learned, and this is in adults and children, that if we do focus on weight, and this is important to say, if you focus on weight and you're in a smaller body size, or if you focus on your weight and you're in a larger body size, we know that leads to body dissatisfaction, and that leads to lower self-esteem. So we know that the effects are that when you focus on the weight for any period of time, it can really lead someone to feeling not well about themselves. They can really learn to not like themselves and lower their self-esteem, which obviously is a factor you don't want to have. And then we know then it goes further. Body dissatisfaction leads to lower physical activity, unhealthy behaviors, and actually weight gain. So the purpose of your focusing on weight and helping them lose weight, you've actually potentially led them to feeling bad about themselves, and then we know that then therefore they won't participate in healthy behaviors. Such as eating their fruits and vegetables and taking care of their mental well-being and their physical activity level. So we've just really undone the whole purpose of what we wanted to do. And certainly there's a social belief about shaming people about their bodies and, the Bigger Loser competitions, and that there's a social belief that will motivate someone to make change if you just brought it to their attention that they're in a larger body size. But the research is just not supporting that. It's leading to certainly weight stigma, and like I said, undoing the very thing that we've set out to do, which is increasing their physical activity levels and their health behaviors. So that research can go across the board. Just a little bit more we know about pediatrics, because it's obviously where Jennifer and I, our background is, but we know that the negative attitudes about weight can start really early, that weight stigma can start even in preschool, where preschool age children can pick up the idea that their friends that they would choose friends based on their weight, that a peer that's in a larger body size might be an undesirable playmate. And that is carried through, that weight stigma is carried through right into adolescence, where we know that 92% of adolescents report that they've witnessed their friends being teased or bullied because of their weight. So kids deal with this, and it's certainly something we need to talk about, and messaging we need to make clear. Most of that is in daycares and schools, but we know that it's in the home environment as well. Almost 50% of females and 34% of males report that they've been teased by family members because of their weight. So again, that loops right back into the causing body dissatisfaction and leading to unhealthy behaviors. And physical activity also adds another layer of weight stigma. So not only, does someone comment about your body or someone's body just standing there. Now, when you're physically active, you're asking someone's body to perform. So you're asking someone to do something. Their body's literally on display, and their abilities and their skills are evaluated. So that can add another layer of stress for people, and it certainly can add another layer that, if you're not careful about the language you use and the environment you create, can lead to more weight stigma. And certainly that's what we found in the research, that 84% of kids report being teased in physical activity, and almost 40% report being excluded or left out, ignored. And that's not new to Jen and I. We've certainly heard that throughout our experience with patients working in clinic, that's a number one reason for not participating in physical activity, is that they've had such negative experience in the past. So again, you're just undoing the very thing you've set out to do by not creating that safe space in that physical activity environment. So all this information led us to say, okay, what can we do with this? Can we change what we're doing within our programming? Can we help people in the community change what they're doing as well?
Okay, so we're just going to reflect on the activity I had you complete earlier in the presentation. So I asked you to think of a person who you admired and list 3 reasons why. So what are some of the things you've written down? Generally, people will say kindness, intelligence, loyalty, humbleness, something to do with personality. And that's the reason why you admire someone. In contrast, when you think about yourself, list 3 things that you would want to change. Most people have at least one of the things they would like to change about themselves is appearance related. So this is telling us that we're not happy with our own body, and most of us have body dissatisfaction, and therefore we're biased when we're looking at promoting, decreasing weight stigma and promoting this positive body approach in physical activity. So why do we think that our bodies matter so much in our worth as a person?
So this led us to creating what we're calling a body positive approach. In the research, sometimes you see it called health at every body size, or weight non-weight based approach. So with the kids and with our program, we call it a body positive approach. So it focuses on fostering body appreciation, taking care of one's body. So through all the health behaviors that we know are what's good and what's valuable and what does make our body healthy. And it does promote health behaviors at all body sizes. So there's no talk of weight loss. That's not a primary goal. It may happen as people choose to take on or adapt more healthy behaviors, but it's not the sole goal. And the purpose of the approach is really to focus on those other goals of increasing health behaviors, such as healthy eating, taking care of your mental health, and increasing your physical activity. So the number one step that we felt that as healthcare professionals or just parents, for our own well-being, that we needed to do first was really to recognize the stigma that is based in our culture and our social beliefs. As you walk through that activity with Jen, you might have seen even your own stigma within yourself, and how you judge your own self. So certainly the first step is to really look at your own assumptions, your belief, your judgments about body weight and size, And this includes assumptions made about other people and their character based on their weight, and assuming, for example, someone might be lazy or not fit because of their body size, or that someone only eats unhealthy food because of their body size. So that would be the first thing to do. And then educating yourself and being aware of those assumptions and how they potentially are affecting your clinical practice or the care that you provide people. And then working systematically to helping change those personal assumptions or biases. We know obviously intelligence or can't be dictated based on someone's body size, someone's personal character, and you've seen that even the person you may have picked that you admire the most could be in a larger body size, and you could have wrote very kind things about them, and we know that, but how it plays into her judgments is often seen across the board. So we have to work hard to making sure that our assumptions are based in reality or based on fact. So one of the things that we found helpful is the Rudd Center, which offers a toolkit. It's directed to healthcare professionals, but it's about weight bias. It's about how you offer how you care for someone in your practice without causing any harm, unintended, obviously, but causing any harm because you've caused weight bias or you have stigmatized that patient in some way. So we found this module very helpful. It's something that you certainly can walk through. If you Google the Yale Rudd Center, you'll certainly find it, and the modules you can work through at your own pace. We also, as we've talked about, is it's really important that you recognize what health looks like. That goes right back to our point that we now know that weight doesn't equal health, and that looking at the research and valuing the research and your patients in front of you, knowing that we know lots of people that are healthy or unhealthy and in varying body sizes. We love these pictures. These are actually pictures of Olympic athletes, and you can see the huge variance in body types. And we would all certainly say that if you made it to the Olympics, you are healthy and that you're probably participating in lots of health behaviors. So we know that we would never judge those people and deem that they are unhealthy based on where they've worked so hard to get. But their body sizes vary significantly. So we would never want to judge them based on simply their body size and dismiss all their hard work and that they're very healthy.
Another thing that we can do is provide a safe space. So we need to recognize that many obese patients have tried to lose weight repeatedly. We need to consider that patients have had negative experiences with healthcare professionals. So approaching our patients with sensitivity and empathy. So you're seeing here, provide safe space, have clear guidelines around appropriate language, conversations, and behaviors. So that's even with coworkers, avoid the, you look so good, you've lost weight. Those sorts of comments, they can be harmful. So don't make comments about people's weight or appearance ever, as a rule. Do not encourage physical activity solely to reduce people's weight or change their shape. That's something that comes up quite a bit with patients. You'll see their goal is, I'd like to lose weight, and this is why I'm participating in physical activity. So kind of having the conversations with them of shifting from their goal from weight related to health focused. Then also think about the physical space in your clinic. This is the area where you assess patients, the area where you expect them to do exercises. Is it welcoming and comfortable for everyone? What's on the walls? Do you have inclusive pictures on the walls? Are all of your posters just people in smaller size bodies? Or, all of these things we have to keep in mind. Be a role model. So healthcare professionals need to model a respectful, inclusive attitude. Even about ourselves. Going back to that activity that we did, if you have body dissatisfaction and negative kind of attitudes about body size for your own self, that can be projected then onto your patients. So keep that in mind. Don't make negative comments about your own weight or body shape. You see it's the office talk at the end of a long weekend, like Thanksgiving, which was recently, like, I ate, my pants don't fit anymore. I ate so much turkey over the weekend. I got my fat pants on today. as examples. So that kind of stuff, again, can be very harmful. So avoid it. Be media smart. So like I alluded to earlier, be mindful of the program posters or brochures. So show some photographs of people of all sizes being physically active, and this is being inclusive. So you don't have this, patients that are coming in who may have body dissatisfaction. Don't look at these posters and say like, oh, these people are all in a smaller body size, so they're all fish. I can't ever participate in that activity because I'm in a different body size. So the pictures here on this slide are from the Red Center website, and they have a library of pictures that you can avail of in all different body sizes. So for my patients, I often recommend different YouTube videos, but it's really hard to weed through them and to make sure that they're appropriate. So I'm very conscious of that because I'm not going to send a YouTube video that is, all about weight loss and the people in the video are, all in one specific body type. So it takes a nice bit of work to make sure that I'm being inclusive. And we want our children to understand that people of all shapes and sizes can be active and can enjoy it, and everybody can reap the benefits from it. So we want to set health goals. So do not make goals focused on weight loss. Instead, set a fitness or a health goal. So explore all causes of presenting problems in addition to body weight. We want to emphasize the importance of behavior changes rather than just weight loss. We want to acknowledge the difficulty of achieving sustainable and significant weight loss, and recognize that all small lifestyle changes can result in meaningful health gains, which is very important. And focus on the feeling. This is something I promote to my patients all the time. If your goal for joining some sort of physical activity program, or if you're just going out walking, these are great goals, and focus on how it made you feel afterwards. You may not see changes in your body size, but did you feel great? Yes, of course. So this is just kind of how I explain promoting physical activity in general, which can help or be very helpful for your own programs. Something you want to look at is motivation. This is something I see come to my clinic all the time. So my patients will say, I have no motivation. I can't get up and move. I need help with motivation. And this is something I talk about. If you are sitting around waiting for this mystical motivation to kick in, you're going to be sitting forever. So action fosters motivation. You have to move, you have to get up, you have to participate in the program and get moving, and then focusing on how it makes you feel and using that to kind of get you to the next program or the next walk. Dragging your heels to the program, fine, but then after you participate in it and you're feeling so good and those endorphins are flowing, you're going to remember that for the next time when you're like, oh, I don't want to go, but I felt so great last time, so I'm gonna pull myself there. But motivation is never going to show up. You kind of have to act first. That's an important point. Focus on the feeling, like I've talked about. How are you feeling? How did that just make you feel? You'll never hear someone say, that was the worst hour of my life. I totally regret going to that yoga class. That's not a thing. Your patients will always feel, or for the most part, will feel wonderful after participating in some sort of physical activity. That's just science. Stick with what you enjoy. So again, my patients will come in and, talk about boredom and talk about lack of physical activity and not knowing what to participate in. And I always say, you're the expert on you. So choose an activity that you enjoy, because if you're enjoying it, you're more likely to stick with it. There's no use of saying, okay, I'm telling you to go out and ride a bike this week. And your patient will say, well, I don't like bike riding. Chances are they're not going to stick with that. So it's not going to be a successful activity for them. So focus on what they enjoy is very, very important. And then KISS. Keep it simple, silly. So when you're trying to promote physical activity to your patients, if they live in rural Newfoundland or they live, in a smaller community and they're saying, oh, I'm gonna join the gym, which is an hour drive away, and I can only get there on every third Tuesday. That's very complicated. Physical activity can be as simple as going out in your backyard and enjoying nature, going for a walk, going for a hike. It doesn't have to be complicated. The more you keep it simple, again, the more likely patients are going to stick with the activity. So how do we promote physical activity in all body sizes? So to just recap, we want to educate yourself. Be aware of your own judgments about body weight and size, including assumptions made about a person's character and their ability based on their weight. Because someone is in a smaller body size doesn't mean that they're not able to do certain physical activities, or vice versa. If someone's in a bigger body size, just notice your own bias and making the judgments about their ability to do something. It's up to the patients what they believe they're able to participate in, and not your own bias on it. Recognize health. So good health comes in many body shapes, sizes, and weights. Weight does not equal health. Provide a safe space. Having clear guidelines around what's appropriate. Be supportive to participants' needs. You want to be a role model. Watch the shop talk. My fat pants, for example. That's a no-no. Program leaders need to they need to model respectful, inclusive attitudes. And that's an important thing. I talk to patients, I talk to their parents. Modeling these respectful, inclusive attitudes are very, very important. Be media smart. What resources are you offering to your patients? Are the resources using a body positive approach? If not, can you find some sort of alternative? Set health goals. How often are goals from patients about losing weight? Instead of encouraging your patient to set health goals, make sure that they are SMART goals. So setting examples in the workplace instead of another Biggest Loser competition. So for example, you hear these Biggest Loser competitions come up, usually around January, or sometimes right before the summer. So maybe make it an activity competition instead of a weight loss competition. And that's promoting doing the modeling, and it's promoting health professionals to get out and be active and participate in health behaviors, and not focusing on something that can be potentially damaging.
So we want to thank you for joining us today. If you have any questions, they can be directed to us through our email address, which you can get via the website. Jennifer and I are certainly available to anyone to have a chat on the phone or answer email, and we can certainly share with you any of the research that we presented today. So feel free to reach out should you have any questions or concerns. We thank you for your time, and we thank you for your efforts in helping everybody, you and the people around you, being healthy and happy. Take care.